Hi, this is Dr. Chiungos. I want to take a moment and talk to you about what it is that chiropractors do. What is exactly that we treat? Oftentimes people come to chiropractors, they get relief, they tell their friends. Chiropractic has survived over 100 years because of this. But oftentimes I find even my long-term patients don't understand exactly what it is I treat. So let me take a moment and read something to you from Medicare, as they've defined and done quite a nice job of it, of what it is a chiropractic treats. A chiropractor treats a motion segment in which alignment, movement integrity, and or physiological function of the spine are altered, although contact between joint surfaces remains intact. This is the Medicare definition of subluxation. As a matter of fact, it's very similar to what my state Mass General laws allows me to detect and treat in patients. But what does this all mean? What is a motion segment? Okay, let's take any joint. This happens to be a spinal joint of the low back. Where two bones meet and cartilage intervenes, we have a motion segment. In other words, this is classified as a joint and it has the ability to move, okay? So, any motion segment or joint in which alignment, okay? Sometimes we see on x-rays where something has shifted forward either due to a fracture or due to degenerative change, okay? Sometimes we see movement integrity. When I order films where I have the patient actually bend forward or bend backwards, that these motions can be altered. And we see them on the films. It's a great way to demonstrate it, okay? Physiological function of the spine. Okay, we know that the spine should move in certain patterns. The neck moves slightly different than the mid-back. The mid-back moves slightly different than the low back, okay? But there are known biomechanical patterns of movement, okay? And so as we start to look at what subluxation is, we know now that it's a joint problem. In this case, it happens to be a spinal joint problem in that there's misalignment either due to trauma, motor vehicle accidents, slips and falls, or repetitive trauma, sitting at a computer, head forward, using a mouse all day. These all can cause damage. Once damage has occurred, now this alignment and movement pattern is altered. The body compensates for that. In long term, there are adaptations. Sometimes even there's a study in Chicago right now showing that blood pressure, body temperature, and regulation of these physiological functions, not just locally, but globally, can be affected. Now, for the purpose of this video, I don't want to go too far in depth, but how do chiropractors know that their subluxation exists? One very simple way, an x-ray. Oftentimes, a chiropractor will order an x-ray series to see if there's evidence of this misalignment. In x-ray, oftentimes we can have motion studies done where the head is flexing or the back is flexing, and we will see any area of the spine that has improper motion. On a physical exam basis, range of motion. Can I turn my head all the way to the right, but now I can only go to the left? Or it hurts when I move it backwards, okay? Pain, asymmetry, misalignment, range of motion abnormalities, tissue and tone changes. Have you ever looked at someone and you see one part of their back is really swollen and large and the other part is either normalized or weakened? Okay, these are the things that we look for when trying to detect chiropractic subluxation, or subluxation as Medicare defines it. In my next video, I'll talk about correction. This has been Dr. Chiungos. Thank you very much for watching my video.